Okay, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, everyone. I'm Yazan Almasry, and I'm today going to be teaching you lung mechanics 1 and 2. Okay. So like always, I like to clarify concepts before getting into the actual stuff. And since I guess someone yesterday explained the lung volumes in a lecture, I'm not going to be explaining it like in detail. I'm just going to go over it quickly. Okay. So what are lung volumes? They are basically different volumes in the lung that we have in different periods. Okay. Now, in normal breathing, the one that we're like constantly doing without like having to force it out is known as the tidal volume. Okay. So here we have, for example, the inspiration where we're getting air, and the expiration where we're leaving air out. Okay. So this is known as the tidal volume. Nothing difficult. It's very simple. Okay. Now, at the end of the tidal volume, where we have the expiration, okay, we have this amount of of the air inside the lung, and this whole thing is known as functional residual volume, or FRC. That's all I need you to remember from this slide for this lecture. The rest of the volumes, you're going to study them from the other lecture. I don't want to repeat the whole thing because that would take too long. Okay, is that clear? Should I move on? Because that's all what you need from this lecture. Okay, yes. Okay, tamam. Okay, now, okay, so here I want you to focus a little bit. Okay, so normally when we talk about, or when the doctor talks about the pressure, whether it's atmospheric pressure outside or inside the alveoli, he mentions that the pressure is usually 0. Now, what we mean by 0 is that we mean 760 millimeter mercury, or the atmospheric pressure. When we say 0, that means it's literally the atmospheric pressure. It's not different from the atmospheric pressure. It is not actually 0. It's just we like to mention it as 0. طيب? So whenever we mention 0, it's actually 760 millimeter mercury. It's not actually 0. But for the sake of convenience and understanding, we mention it as 0. Tamam? طيب. Now, we have pressure here outside the alveoli, and we have pressure here inside the alveoli. And in anything in life, in physics, in whatever it is, we always have to have a pressure difference. So we're going to have pressure in the alveoli, pressure 1, and pressure outside the alveoli, pressure 2. If pressure 1 equals to pressure 2, what does that mean? That means we're not going to have air moving in or out because the pressure is at an equilibrium. It's equal to each other. Nothing is going to move in and nothing is going to move out. But what happens if pressure 1 is greater than pressure 2? And I want you to type this in the chat. So if pressure 1, for example, equals 2, pressure is 2 equals 0. Where is air going to move? Is it going to move from pressure? Okay, it will move from 1 to pressure. Okay, so yeah, the air, okay, the thing that we have here is air. Air will try to move from areas of higher pressure to areas of lower pressure. Always, always. Okay, so whenever we mention pressure, we talk about pressure. Air likes to move, or water, or whatever it is, it likes to move from area of high pressure to area of low pressure. Since P1 has a greater pressure than P2, it will move from P1 to P2. In other words, it's going to move from the alveoli into the outside world. And this is what is expiration. Okay? When we exhale, we're letting the air outside. And this is basically because of a pressure difference. Okay? So that's the first thing. Now, let's say we have P2 is greater than P1. Tamam? What does that mean? Where is air going to move, and what's the process called? Inhalation. Perfect. Okay? So that's exactly what's written in this slide. And now basically, whenever we have a pressure gradient, so let's say in the alveolar atmospheric pressure, it's 5, and the outside atmospheric pressure is 0, we have a net or gradient pressure of 5. That means the air will move out of the alveoli into the outside world, and this is expiration or exhaling. Tamam? Is this concept clear? Are the first two concepts clear, or should I repeat anything? Clear. Am I moving too fast, or it's good enough? Good, good. Okay, perfect. If anything unclear, let me know. تمام. طيب, بسم الله. طيب. So first of all, Dr. Shams has amazing slides. I didn't think I needed to change in them. I just added some things to make concept easier. But mashallah, his explanation is really good, and I think his slides are already good enough. طيب. So he just mentions in this slide, he's talking about compliance. Now, I talked back in my session for cardio. I don't know if people attended or not. I talked about compliance, and I said compliance means how compliant something is. It means how much it allows for expansion, or how much room it has for expansion. So if compliance is high, we have, again, I mentioned this before, we have less stiffness, okay? So the more compliant the lung, the more likely it is to expand easily. The more likely it is to be less stiff, okay? So this is what compliance is, okay? And this is important. We want to understand the compliance of the lung for many reasons. One of which is that the compliance will be different in diseases, okay? So this is why we're studying the normal, to understand the abnormal, okay? So here he's just showing us that basically if we inflate the balloon, okay, we have like a system, okay? If we inflate the balloon, what's gonna happen is that we're gonna increase the pressure. And once we increase the pressure, this balloon is gonna expand. And it's just pretty much any simple physics. There is not much to explain. Sorry. Tamam. Now, what compliance is as an equation, it's the change in volume over the change in pressure. So let's write it here. Compliance equals change in volume over change in pressure. Tamam? Okay. So let's say that we plot the compliance. Okay, this is the graph that we're gonna get. Okay, I mean we plot the volume over the volume divided by the pressure. Okay, we're gonna get this graph. Okay, why do we want to get this graph? Okay, what do you get out of this graph? First of all, we're seeing that the more we increase the volume, the more the pressure is increasing. So the more we go up the curve, the more the pressure is changing. Yes, yeah. Okay, clear. Higher compliance means more air. It doesn't mean more air. It just means that we have easier expansion. Yani the lung expand more easily. Okay. Do you know how in the balloon, for example, it's very difficult to inflate the balloon in the first part, but then it's really easy to inflate the rest? The same thing, because at the beginning we have less compliance, and then the more you inflate the balloon, it will become more and more compliant. Okay. Tamam. If it, what does D stand for? Okay, D, it means change. Okay, so we're talking about change in volume. So volume before expansion, so volume 1 minus or volume 2 minus volume 1 over pressure 2 minus pressure 1. It's the same thing. D means delta, like this. Okay. Tamam. Okay, now if you notice in this curve, in this graph, what is the compliance? It's the change in volume over the change in pressure. So in other words, it's the slope. Okay, so the steeper the slope, I'm gonna write this down because it's important. The steeper the slope, the higher the compliance. Wait, sorry. The higher the compliance. If it's not steep, if it's not steep, look here, the steepness is getting low. That means compliance is low here. Look at the steepness here. It's very steep. That means compliance is high. Does that make sense? Yes or no? Yes. Okay. Yes. Fine. So the whole point of this slide is we're trying to understand the relationship of compliance to volume and pressure. Okay. So the more the volume, the compliance is basically this equation. Okay. So we're trying to understand what's this equation. So compliance equals change in volume over change in pressure. And delta means delta, yani this is delta in the mathematical formula. So it's just a change, okay? But, and again, we said slope equals compliance. So these are like the two more important points in this slide, okay? And we said the steeper it is, means more compliant. Tamam? So this is what we mean. And what did we say compliance is? It's how easily the lung is expanding, okay? And yani, the more the compliant, the less stiff it is, okay? Does that make sense? So I can move on to the next. Because we're going to be talking about compliance throughout the whole lecture. If you don't get it, it's fine. Let me know from now. Yes, yes, yes. Okay, perfect. Tamam. Okay, so now, now we need to understand. Excuse me. Okay, so we need to understand that compliance of the lung is different from the compliance of the chest wall, is different from the respiratory system compliance. Okay, so respiratory system is this whole thing. It's the chest wall as well as chest wall, pleural space, and the lungs. This is all the respiratory system. When we talk about the lung, we're just talking about this lung only. We're not taking into consideration the pleural space or whatever. When we talk about the chest wall, we're just talking about the chest wall. Tamam? Each one has different compliance from the other. Keep that in mind. Tamam? Okay. So when we talk about the compliance of the lung, the volume, when we talk about all the compliances, the volume will be the same. Look, it's just the change in volume. There's no difference. Just a change in volume each. Okay. However, when we talk about the pressure, it's going to be different, what we compare in each one. So when we talk about compliance of the lung, okay, we're talking about the change or the pressure gradient. Okay, so it's going to be the change in the volume over the change in the pressure. So what is the first pressure? It's the alveolar pressure, okay, or the pressure inside the lung. Now, from outside, what is the pressure that is working against that, or the pressure that's working against the alveolar pressure? It's the pleural space pressure. Tamam? That's why this equation here, we got the pleural space pressure from. Tamam. So this is the first equation for the compliance of the lung. It's the change in volume over the change in pressure. And we said the pressure will be the difference between the alveolar pressure minus the pleural space pressure. Now, we're going to move on to the chest wall equation, the compliance of the chest wall. Now, it's going to be, again, just the change in volume. And whatever volume it is, we don't have much to concern about the volume. We just want to focus on the pressure. Now, the pressure is going to be what? It's going to be the change in the pressure from the pleural space, from here, compared to the outside, which is also known as the atmospheric pressure, or PB. Okay? Minus PB. Because literally these are the two areas between the chest wall, tamam, or that affecting the chest wall. So this is the equation. Again, for chest wall, it is a change in volume over the change in pressure, and the change in pressure is the pleural space minus the atmospheric pressure. Tamam. Lastly, we have the respiratory system. It's taking the whole thing. Tamam. We mentioned this. Keep this in mind. Respiratory system, we're not just talking about the lung, we're talking about the lung, the pleural space, and the chest wall. Tamam? Okay. Now, for the respiratory system, and they mention it here as RS, okay, the equation will be the change in volume over the change in pressure. Now, the change in pressure is going to be what? It's the difference between the alveolar pressure minus the atmospheric pressure. So the pressure here, I'm going to put a check mark, minus the pressure here. طيب. Now, if you notice in the equation, they did write this, but at the end they wrote in it equals just to PA or PPL. Okay, why? Because we mentioned before, atmospheric pressure equals to what? It equals to 0. So PPL, or pleural space pressure, minus 0 is equal to pleural space pressure. And alveolar pressure minus 0 is equal to alveolar pressure. Tamam? Do you know how we derive this equation now? I hope yes.
Yes, thank you.
Okay, perfect. Now, one last point that I want you to understand from this slide is that if we have two of these, like we have the compliance of the lung, and we have the compliance of the chest wall, and the compliance of the respiratory system. If we have two of these, we can get the third. How do we get the third? We use this equation. So let's say I tell you, for example, compliance of the lung equals 2, and compliance of the chest wall equals 2. Tamam? And I ask you to calculate the compliance of the respiratory system. How do you do it? Use this equation. Tamam? So this equation says that the compliance of respiratory system is equal to 1. Yani how do we calculate it? We use the reciprocal of each. So 1 over the compliance of respiratory system equal 1 over the compliance of the lung plus 1 over the compliance of the chest wall. So now we know that the compliance of the lung and the chest wall equal to 2. So it's going to be 1 over compliance. It's just math, yani. I'm just doing it for the sake of completeness. Tamam? Plus 1 over 2. So it's going to be equal 1 over 4 equals 1 over. So what is the compliance of the respiratory system? It's 4. Does that make sense? Or actually, sorry, it's going to be 2. My math, I'm so stupid, actually. I'm sorry. So it's going to be, sorry. So 1 half plus half is equal to 1. So it's going to be 1 over 1. So the compliance of the respiratory system is going to equal to 1. Tamam? Does that make sense? I know I confused you with, with my stupid math, but I hope that makes sense.
Yes.
Okay. Is everything clear on this slide? Because he will ask you about this, literally.
I just have one question. Why is the body surface 0?
Body surface type. So it's not body surface, it's the body surface pressure. And it's atmospheric pressure. Tamam? Atmospheric pressure. And it's not actually 0. We just refer to it as 0 as like, instead of saying 760 every time, for convenience, we say 0. Tamam? It's easier to use this for the pressure difference.
Okay.
So just keep in mind, whenever we talk about atmospheric pressure, it's 0. Tamam?
Yeah.
Type. If I give you another equation from this slide about how to calculate, for example, I tell you the chest wall, the compliance of respiratory system is equal to 3, and the compliance of the lung is equal to 1. What is the compliance of the chest wall? Can you guys do it? I'm going to calculate it on my phone because I don't actually know the answer. So you can use a calculator. In the exam, you're given a calculator, so don't worry. One over, wait.
It's 2, it's basically 2 over 3, but if you change the reciprocal, it's 3 over 2.
Wait, let me see. 1 over 3 minus 1. Yeah, that's the answer. Wait,
It's
I made it.
because it's the reciprocal, so
It
changes
should
to
be.
positive.
This should be any different number, but I guess you guys get how to substitute in the equation, right?
Yeah.
Literally just substitute it in this equation.
So it's 3 over 2.
It's no, it's gonna be 1 over 3 minus 1 over 1. It's gonna be a negative value. It's gonna be like
the
negative.
reciprocal of a negative is a positive.
Yeah, so it's gonna be 3 over 2. But don't worry about this. Yani this is like it's like the most difficult question they will ever give. So forget about the numbers because the number will be really easy, like this one. This one. Just get the concept. Sorry, this one. Tamam? Just get the concept of the equation. Okay. Do you guys understand?
Yes.
If I lost you somewhere, let me know. Okay. Okay. Now here is like one of the important concepts in this lecture, which is basically the pressure volume curve. Tamam? What is the pressure volume curve? It's basically we take the pressure and we take the change in volume and we plot it in a curve. Simply, yani. Excuse me. We flip after adding it. You don't, yani, just substitute in the equation. I don't want to teach you math all over from the beginning, but I'm going to do it, yani, just for another example. So since it's in this equation, wait, I need an empty slide. I'm just going to get an empty slide. So the equation is 1 over compliance of the respiratory system equals 1 over the compliance of the lung plus 1 over compliance of the chest wall. Let's say we said, let's say we have the compliance of the respiratory system equals to 2. I'm going to create a new equation, and the compliance of the lung equals to 4. طيب. What is the compliance of the chest wall? So we start by substituting. So 1 over 2 equals 1 over 4 plus 1 over compliance of the chest wall. تمام. طيب. So by math, what do we do? 1 over 2 minus 1 over 4 equals 1 over compliance of the chest wall. طيب. So what is 1 over half minus 1 quarter? It's going to be 1 over 4. يا رب ما يكون I got it wrong and my math مضروب. Okay. So okay, so the answer we're going to get is 1 over 4. So 1 over 4 is equal to 1 over the chest wall compliance. So just by doing the crossover in math, it's going to be chest wall compliance equals 4. Does that make sense?
Yeah.
This is taking it with every step. I hope it actually makes sense. Okay, تمام. So now this is an important concept. Okay, it's about the pressure volume curve. طيب. Now what do we need to understand from this? We need to understand multiple things, and I'm going to explain to you from the beginning how to look at a curve. طيب. But before that, remember when I told you the respiratory system, what is it? It's not just the lungs. It's the lungs plus the pleural space plus the chest wall. تمام? Just keep that in the back of your head, because you might think in a respiratory system just the lung, and I know it's very easy to think that, but no, it's the lung plus the chest wall plus the pleural space. It's a whole system. تمام? Just keep that in the back of your head. Now, when we look at a curve like this, a pressure volume curve, I have a way of looking at it. You can have another way, it's fine, but this way is the easiest way. First of all, we look at the point where the pressure equals 0. Okay, so we search for it. Okay, where's the pressure equals 0? Here. Okay, now when the pressure equals 0, this is the point where the pressure equals 0. It's at FRC, or functional residual capacity. Why is this point important? Because when the pressure equals 0, it's also called resting volume. Tamam. What is the resting volume? So simply explained, resting volume is the point which the respiratory system will try to move towards. Okay, so in this case it's at FRC. So if the volume is here, the respiratory system will try to push towards it. Okay, it will try to increase the volume and go towards the FRC to reach the resting volume. If the volume is around here, it will try to go down by exhalation and go back to the normal resting volume. So the resting volume is the point at which we're always trying to get to it. And in the respiratory system as a whole, it's equal to FRC. And this is just in the respiratory system. Keep that in mind, not in the lungs, it's in the respiratory system. FRC, sorry. Okay. طيب. So that's the first thing we need to look at. We look at the point at which pressure equals 0. طيب. Now, the second point, second thing we look at, the point at which the compliance is the highest. Now, this point is also the FRC, okay? And subhanallah, it's at FRC. Only in respiratory system, just keep that in mind, okay? Because we have different curve for lungs and different curve for chest wall. طيب. And subhanallah, compliance is highest at FRC, and that's very convenient, and that's the best for us. Why is that? I'll tell you why. Because at FRC, it's the point where we're breathing normally without any effort. يعني مو لازم تعب حالنا عشان نتنفس يعني. And the compliance is highest at that point, meaning that we're breathing very comfortably. We don't have to actually put effort into it. If the compliance was low at FRC, what would be the case is that we have to force in the breathe. We have to breathe in so hard that we actually have to make an effort for it. So alhamdulillah, the way God created us is that the compliance, the highest point of compliance, okay, is at FRC, okay, for the respiratory system. And again, remember, what is compliance? It's the steepness of the curve. So the steepest point at the curve is at FRC. Tamam? Or the slope of the curve. طيب. There's someone in the chat. Isn't FRC forced exhale plus residual volume? Yes. So going back to here, this is FRC. I explained it and I said here, from here to here, this whole thing is FRC. And this is our normal breathing. So FRC is literally after a normal exhalation. يعني when we're talking, you're like inhaling and exhaling. After a normal exhalation, we have FRC. So after that normal exhalation, the highest compliance is there and the resting volume is there. Tamam? Does that make sense? Okay, tamam. So these are the two most important things to look at. So again, repeating from the point, we're talking about the whole, in this graph, we're talking about the whole respiratory system. We're not just talking about the lungs, okay? Excuse me. And we said that, first of all, we look at the point where pressure equals 0. And this point is here, and it's known as the resting volume. Now, at the resting volume, it just happened to be at the FRC for the respiratory system. Type. What does that mean to us is that the respiratory system will always try to move towards FRC, or the resting volume. Type. That's the first point. The second point, here it is. The second point is that we want to know the point at which we have the highest compliance. Why do we need to know it? Because this is the point at which we breathe most easily, and this is for the respiratory system. Okay, alhamdulillah, it's at FRC, meaning that we're easily breathing every day. Tamam, does that make sense? Can I move on to the next volume? I mean, to the next graph, or? Yes. Okay, tamam. All clear, tamam. Okay. Now, if we take the lung individually, just the lung, okay, and we do a pressure volume curve, this is what we get. We get a different curve, because respiratory system is, again, what? It's the lung plus the pleural space plus the chest wall. It's not just the lung. So if we take the lung individually and we measure the pressure in the lung individually, and again, remember what's the pressure in the lung? It's the alveolar pressure minus the pleural pressure. And in the respiratory system, it will be the alveolar pressure minus atmospheric pressure, which is 0, so it's equal to alveolar pressure. Just keep that in the back of your head, okay? Now, this is the graph that we're going to get. So first of all, what's the first thing that we're going to look at? Can you tell me in the chat? I mean, I wrote
Resting
it.
volume.
Resting volume, which is the point at which the pressure equals 0. Tamam? So let's go back to the graph. This is the point at which the pressure equals 0, okay? And if we go up, this is the resting volume here, okay? So it's around like 500 ml, right? Now, again, what is the significance of this? Is that the lung will always try to go towards the resting volume, this point, okay? It will always try to push. So if we're at this point, it will always try to push towards it, okay? It will always try to push towards it. Now, if we take the lung individually, okay, it will always try to push towards the rest volume, meaning that it will decrease in volume, okay, and decrease in size. It will try to collapse on itself. This is if we take the lung individually, okay? So that's the first thing that we're talking about, equals 500 ml. Just keep that in mind. The second point is the point at which we have the highest compliance. And it's around the same area, okay? And this is where the compliance is highest, okay? Now, here is the thing that is really, subhanallah, God made us by nature, is that as we go up the curve, the compliance gets less. You can see the curve becoming less steep. Why is this nice? Because we don't want to make the lung always compliant, because if the lung is always compliant, it's going to keep expanding to the point that it actually explodes. So if the compliance becomes less, that means what? That means at some point the lung will be stiff and will not allow more air to go in. That's why we can only inhale so much. Otherwise, we can inhale more than normal and the lung will actually blow up. Alhamdulillah, that doesn't happen because the compliance here is low, while the compliance here is high. Tamam? So the point that I wanted to get out of this slide is that if we take the lung individually, the resting volume is around 500 ml. And if the lung is placed individually without the respiratory system, it will always try to collapse upon itself. Does that make sense?
Yeah. So it's always below the residual volume, but not 0, so it doesn't collapse.
Yeah. It doesn't, that's not the reason why it doesn't collapse. It doesn't collapse because it's a part of a whole system. And I'm going to explain that in a minute. Or I can actually explain it here just to make everything connect. So now, having the lung collapse is a really bad thing. And we don't want that. We want the lung to actually be expanded, like this one, a healthy one. Tamam? This one is also healthy, but I just drew it like it collapsed. Tamam? What's the thing that prevents it from collapsing? Is that the pleural space, the thing that we have here. The pleural space acts like a connection between the lung and the chest wall. And it prevents the lung from collapsing, because otherwise, if the lung collapses, that means we're not going to have enough air going in. We're only going to have like around 500 ml. And you guys know from the volume of the lung that that's not enough air, right? We need more. So I'm going to explain in the next upcoming slides more about that concept. Just keep that in the back of your head. For now, do you guys understand? Highest compliance, I don't know the exact point at which they have the highest compliance. It's just around this area. You don't need to know the actual number, unless it's mentioned in the notes, which I still think you don't need to know the exact number. Just know for the last one here, it's at FRC. All clear, tamam. طيب. Now the last part is what is the chest wall. And just imagine and bear with me that this is the chest wall. تمام? طيب. So it has a different graph from the respiratory system as well as from the lung. So how is it different? Is in that, first of all, what do we look at? Now I want you guys to tell me. I want to see if you guys class and you have the concept in your head or not. What do we look at first?
The resting volume.
And how do we look for the resting volume?
By the pressure becomes zero. By looking at the line, the pressure becomes zero.
تمام صح عليك. Okay, so pressure at 0 point, okay? And here we go up the curve to go this. This is the resting volume. طيب. So notice with me is that the resting volume is higher than the FRC, first of all, تمام? And it's around 4 point something. And let's say 4.2. You don't need to know the exact amount of air inside. Okay, so what does that mean? It means that at FRC, which is the normal breathing, okay, what happens is that the chest wall tries to go up, tries to expand. Tamam? It tries to increase in volume. Here you can see the increase in volume. While if we reach to the total lung capacity, it will try to go down. So again, yani, just the same concept is that we're always trying to move towards the resting volume. Now, again, if we take the chest wall individually, at FRC, the chest wall, will it expand or collapse? Will it grow in size or collapse? Expand. Okay, طيب. Why would it expand? Someone said collapse. Okay, collapse is only for the lung. Okay, I don't want you to just memorize it. I want you to understand the concept. Why is it expanding? Because at FRC, it will try to go up to the resting volume. صح? Now the resting volume is more than FRC, so it's going to increase the volume. When we say increase in volume, that means it's expanding. طيب? Now, on the other hand, in the lung, at FRC, if it wants to go towards the resting volume, it needs to decrease volume. So this decrease in volume means what? It means it's collapsing. Does that make sense? The question that I was asking is that when we are at FRC, will the chest wall try to expand or try to collapse? Collapse? No, it's gonna expand. I just explained this. Okay, so for those who are saying collapse, I'll explain why is it expand. Okay, it's fine, عادي. Okay, so at FRC, we're at this point, okay? We're at this point of the graph. I'm gonna erase everything. Okay, so let's say we're at this point. And the resting volume, again, the resting point volume is the point that we're always trying to get to. طيب? So in the chest wall individually, we're not talking about the whole respiratory system. In the chest wall at FRC, what will happen is that the chest wall will try to move towards the resting volume. It will try to go up. And this is basically increasing the volume. Okay, so when we increase the volume, other way of saying it is that expansion. Tamam? So this is what happens in the chest wall. Is this concept clear? It's very important. Wallah, if you don't get it, I'll explain again. Adi, I don't mind. Just make sure you get it. Tamam. طيب. So this graph again is for the whole respiratory system. طيب. And I already explained this graph, but I just want to make sure you get this concept. I don't want you to get the curve. I want you to get the concept. I want you to understand both actually, but any more so for the concept. طيب. When we talk about the respiratory system, we're taking into consideration that we have a lung, we have a pleural space, and we have a chest wall. 3 things, not just one. Okay. طيب. Now, the first thing that I want you to keep in mind is that there is a connection. The connection between the chest wall and the lung is the pleural space. So pleural space is going to do what? It's going to connect between the lung plus chest wall. That's why they don't act individually. If they act individually, what will happen is that the lung will collapse upon itself and the chest wall will expand. And this is how this happens in a disease that I'm going to talk about. Okay, this is if they act individually, but they don't act individually and they are connected by something. What is that thing? It's the pleural space. تمام? طيب. So that's the first thing we want to understand. This is the curve. The black curve is the one that is for the respiratory system. تمام? And again, for the respiratory system, it's going to be the difference. Okay, so how do we measure? What's the difference in pressure in the respiratory system? It's going to be equal to the change. Okay, it's going to be alveolar pressure minus the atmospheric pressure. تمام. And equals the alveolar pressure because atmospheric pressure is actually 0. تمام. طيب. So when we look at the point of FRC, it's basically the point at which we have the resting volume. It's at FRC. Keep that in mind, please. If they ask you what's the resting volume for the respiratory system, it's FRC. طيب. What's the point we have highest compliance for the respiratory system? It's also FRC. طيب. Now, the whole point of this slide is that he's trying to explain is that FRC is the point at which we have equal distance. Here's the distance from the chest wall and from the lung. Okay, it's the balancing force. This is the balance that's happening between the what's it called? The FRC is the point where we have balance between the chest wall and the lungs. تمام? طيب. This is the equilibrium point basically. طيب. Now, another thing that you need to understand from this slide is that as we move up, okay, the compliance decreases. Okay, now why do we have this decrease in compliance? Because remember when I talked here and I mentioned that the lung has decreased, the lung decreases the compliance as we go up in volume. This is the exact reason why the compliance is becoming decreased here. And I mentioned the reason is that we don't want the lung to expand too much to the point that it explodes. طيب. Now when we go down from FRC, the compliance is also decreasing. And what is preventing this compliance? What is causing this compliance to decrease is the chest wall. Here we can see the compliance is decreasing. طيب. So, subhanallah, the balance between the chest wall and the lung, okay, is that FRC is the perfect point at which we have the highest compliance. And again, why do we need that? So that we can breathe easily. If we move below FRC, the compliance will decrease because of the chest wall. And if we move above FRC, the compliance will decrease because of the lung. Okay, so the way the doctor explained it, he said maximal inhalation. He said maximal inhalation is limited. Limited by what? Can someone guess?
Lungs.
Exactly, by the lungs. And maximal exhalation is limited by what?
Chest wall.
Sorry?
Chest wall. The chest wall.
Chest wall, perfect. Do you understand why or not? I don't want you to memorize, I want you to understand. I hope you all understand it. Understand, yes, clear, no. Yes, clear, no. What does that mean? Oh, yes, I don't. Okay, طيب. So now, again, the graph, this whole graph, if the respiratory system, it's a whole combination of the chest wall plus the lung. طيب, and it's a balance between both because the respiratory system is both the chest wall and the lung and the pleural space which connects both. تمام? That's the first concept in mind. طيب. Now the second concept we said is that here, when we took the lung individually, as we go up the curve, what will happen is that the compliance will decrease. Okay, and we're going to talk about why the compliance decrease at the end of the lecture. Just keep in mind the compliance will decrease. Why? Because we don't want the lung to be so compliant to the point that it keeps inflating and inflating and increasing in volume, increasing the volume. Because if it goes like more than TLC, like way more, it might explode. Like the lung will actually like explode and rupture. طيب? Are you with me until this point?
Yes.
Okay. طيب. On the other hand, the chest wall, the compliance here, as we increase the volume, the compliance is good. It's still high. Okay. However, as we go down, like below FRC, you can see the compliance is going down. How do we know? Okay, from the beginning, maybe you forgot this. How do we know if the compliance is high or not? We look at how steep the curve is. So if the curve is this steep, that means the compliance is high. If the curve is this steep, that means the compliance is low. So here, it's like this steep, so compliance is high. Here is this steep, so compliance is low. Does that make sense?
Yes, yes. Okay, thank you.
Okay. طيب. Now, in the middle between the lung and the chest wall, we have the FRC. And this is the point at which the compliance is the highest for the respiratory system. Because again, it's the combination of the lung and the chest wall together for the respiratory system. And this point at which the highest compliance is known as the FRC. طيب. If we go above the FRC, the compliance will get less. Why is it getting less here? Because of the lung. And why is it getting less here? Because of the chest wall. طيب. Does that make sense or no? If it doesn't, it's okay. I can try explaining in a different way, maybe. Yes. Okay. Alhamdulillah. طيب. So if something, I want you guys to leave with these concepts. First of all, respiratory system is not the lungs. It's the lungs, the chest wall, and the pleural space. Tamam? That's the first thing. طيب. The second thing is that maximal inhalation. What do we mean by maximal inhalation? Is when we go up this curve, when we're going up, this is inhalation, is limited by the lungs. Why is it limited by the lungs? Because we don't want the lung to explode. طيب. And maximal exhalation is limited by the chest wall. As we go down in the curve, the compliance will decrease in the chest wall. Here you can see it. Keep these two in your head. Maybe he will ask you about this. Okay, tamam. Is this clear? Concept clear? Because now we're talking about the normal, we're going to move on to the abnormal in the next slide. طيب. tamam. Now, the abnormal. Okay, so we have a disease that's called pneumothorax. In other words, air in the chest. طيب. How does pneumothorax happen? It's a very interesting case, okay? If someone, for example, has a stab to the chest, what's going to happen is that the pleural space will be ruptured. And we're going to have an opening. And why is that bad? Okay, let's take it a step backwards. Okay, let's say in the normal cases. Okay, in the normal cases, we have atmospheric pressure is equal to what? 0. صح ولا لا? It's equal to 0. Inside the alveolar pressure, maybe it's 0 or maybe it's more, depending on more or less, depending on the whether we're breathing in or out. تمام? In the pleural space, the pressure is -6. Why is it -6? Is to prevent the lung from collapsing. طيب? If the pleural space has not negative pressure, and if its pressure is 0, the lung is going to collapse. Because remember, the lung always tends to collapse on itself. If the pressure is not negative here in the pleural space, it's going to collapse upon itself. طيب. So this is the normal, okay? طيب. Let's say, for some reason, we have an opening in the pleural space. Here, focus with me here. In the pleural space, what's going to happen is that the pressure, خلاص, يعني, the pressure is not contained anymore. It's gonna have a connection between the atmospheric pressure, and it's gonna try to equilibrium. It's gonna reach the equilibrium point. And what is the equilibrium point? It's 0, because the atmospheric pressure obviously won't change from your chest. Your chest will change from the atmospheric pressure. Tamam? So the pressure will be 0 outside and 0 inside the pleural space. طيب. Now, when the pleural space pressure is equal to 0, the pleural space becomes useless. خلاص, it lost its function. And remember, what's the function of the pleural space? It's the connection between the lung and the chest wall. طيب. Given that we lose that connection between the chest wall and the lung, what's going to happen is that they're going to act individually, just exactly like in this curve. The chest wall is going to try to reach to this resting volume, and the lung is going to try to reach to this resting volume. So what's going to happen is that the lung will collapse. and the chest wall will expand. Because we lost the connection, which is the pleural space. Does that make sense? Yes, okay, yes. Yes. Are you sure? Because I'm gonna ask you about this in like a slide. Okay, تمام. طيب, how do we fix this? We need to re-establish the negative pressure. The negative pressure in the first place here in the pleural space is what was keeping everything intact. So once we re-establish this in something that's called suction valve, we literally put a tube inside the patient's chest, okay, and we suck the air out, okay, or basically establish a negative pressure. Once we re-establish that negative pressure, everything is going to go back to normal. The connection between the chest wall and the lung will be back to normal. Tamam? This is pneumothorax, okay? So what is the reason behind pneumothorax? Is disruption of the pleural space or disruption of the negative pressure in pleural space. What will it cause? It will cause the lung to collapse and the chest wall to expand. Does that make sense? Do you want me to re-explain? I have this slide in case someone wanted me to re-explain. I can re-explain once more so the concept sticks to you, but it's up to you. Is it clear? Clear, okay, تمام. طيب, I have a question about this, okay, and I want you guys to try and answer it. Please send me on private so yani, no one sees the answer in the chat and just like get distracted by it. Alhamdulillah, I've seen all the answers that's sent to me correct. MashaAllah. Either you guys are geniuses, or I'm really good at explaining, or a combination of both, who knows. Anyways, the answer is B. You guys did a great job, mashallah. So what happens is that, first of all, let's read the case together. It's a 34-year-old male with a bullet. So again, what does a bullet tell us happening? Is that basically we're having a connection between the pleural space and the outside word, and we don't like that, okay? And it caused a pneumothorax. طيب? So what's gonna happen to the lung volume and the thoracic volume? The lung, it will decrease. Why? Because it's always moving towards the resting volume, okay? And the thoracic will increase. And this only happens because of what? We lost the pleural space, or like the negative pressure in the pleural space. Tamam, is this concept clear?
Yes, yes.
Alhamdulillah, alhamdulillah. Are you guys getting everything so far? Is there any concept that's not clear before I move on? Because khalas, all the rest is going to be different, yani. It's going to be different concepts. Clear. Okay, tamam. Tamam, tamam. Okay. طيب. Now, okay, this slide is talking about the compliance. Okay, now, again, in the first slide, I told you, why is it important to know the lung compliance? We don't care as physicians about the lung compliance for physics, and we don't care that much for physics at all. We just want to know what's the difference between normal patients and patients who have, for example, emphysema or fibrosis. The compliance will be different in each of them. طيب? So, I'm not going to go into the details of the disease, just know this is the normal curve. And in patients with emphysema, this is the curve, and in fibrosis, this is the curve. طيب. I want one of you guys in the chat to tell me what's happening in emphysema, what's happening to the compliance, and what's happening in fibrosis, what's happening to the compliance. Is it increasing, decreasing, or what's happening for each?
And at emphysema, that the compliance increases,
Tamam.
and at fibrosis, it decreases.
صح. So that's correct. So what we can see is that we can't exactly measure it, because if we want to measure it, it's going to take a long time. We just look, rule of thumb, we look at the steepness. So here's the steepness here. It's not that steep. While on this curve, it's very steep, okay? And this is the slope. The higher the slope, the higher compliance. And the lower the slope, the lower the compliance. طيب. So all I want you to get from this slide is that in emphysema, the compliance is high. higher than normal, and in fibrosis the compliance is lower than normal. I'm not going to go into the disease process. There's a whole lecture about this, and I'm sure the doctor taught it by now, I think. المهم طيب, now the compliance in the lung is determined by multiple things, okay, and there are 4 factors. By the way, guys, we got a question about this when I was first year, so keep in mind this is important. Maybe he'll re-mention this slide in the other lecture or not. Just keep in mind he brought this lecture and he said which of the following, and he didn't, like, it wasn't labeled. He just said which of the following represents this curve, and the answer was emphysema. طيب, just keep that in mind. Anyways, okay, so compliance of the lung is determined by multiple things, okay. And again, just to make sure that compliance is understood by you guys, compliance is how easily the lung is expanding, or the more the compliant the lung is, the less stiff it is, okay. So it's the opposite of stiff. تمام. طيب, so it's determined by 4 things: elasticity, interdependence of the alveoli, surface tension, and surfactant. طيب, we're going to go through them one by one. طيب, so first of all, elasticity. And elasticity is the easiest one of them. So what does it mean? It means that the lung is made of connective tissue or elastic tissue. Why is that important to us? Is that from elastic tissue, it's basically elastic fibers. They are very compliant, okay. If for example the lung, let's imagine the lung was made out of wood, it will not expand. On the other hand, if it's made, for example, out of elastic tissue, it can expand, more compliant, right? So if we talk about it, so elastic fibers is increasing the compliance. طيب, there is nothing much to explain in this slide, okay? Does that make sense? Yes, okay. طيب. And you just literally know that the lung is made of elastic tissue, and this elastic tissue is one of the reasons why it's compliant. طيب. Then we have something called interdependence of alveoli. طيب. So what is the interdependence of alveoli? It basically says that, let's take for example this alveoli. Excuse me. Let's take for example this alveoli. طيب. And let's say this alveoli decides that it wants to expand, okay? Now, the issue is this alveoli is not alone. There's so many alveoli around it. There's 1, 2, 3, 4, 5, 6, 7, 8, and more alveoli around it. So what does that mean? It means that this alveoli will tell it, no, I will not let you. It will resist this way. This alveoli will do the same. This alveoli will do the same, will do the same. So what's going to happen is that we're going to have an opposing force preventing this alveoli from expanding. So when this alveoli try to expand, it will not be allowed, because these alveoli will resist. تمام? So this is known as the interdependence of alveoli, okay? And this basically decreases the compliance of this one. Why does it decrease the compliance of this one? Because it's not allowing it to expand. تمام? Does that make sense? And there is not much in
Yes.
it. But if it doesn't make sense, it's okay. I can re-explain. Yes, okay. تمام. Okay, now it's important concept, and it's like, I think you're gonna get a lot of questions about this. Okay, and at the end, come be with me, and I'm gonna tell you what's may you repeat. Sure, of course. طيب. So from the beginning, because maybe the errors get confusing. Okay, we said that interdependence of alveoli mean that alveoli, these all circles are alveoli. Okay, this alveoli, it's not independent, okay? They are dependent on each other. Inter means that they are dependent on each other. They depend on each other. Because let's say this alveoli tries to expand. What's going to happen is that these will collapse. All the alveoli around it, this one, this one, this one, this one, all of these alveoli will collapse. So what will happen is that when this one tries to expand, that this alveoli try to expand, this alveoli right here, for example, will not allow it, okay? Because it will collapse otherwise, okay? So it will push against it. طيب, does that make sense? So this basically, this interdependence of alveoli decreases the compliance of this one. Does that make sense? Okay, yeah, okay. طيب. And it's just simple, don't overcomplicate it. No problem. طيب. The third and the fourth ones are very important. I want you guys to focus on this. Please focus with me. Okay. طيب. So surface tension is a property of water. طيب. And all of our tissue is made of water. طيب. So this is the first concept you need to keep in mind. يعني نحن 70% of us are made of water. And I want you to keep in mind that when we breathe air, it's different material from water. So if we breathe water, what's going to happen is that water, the tissue is water, and we're breathing water. There is no surface tension, and it's so much easier to breathe. Look, this is the curve. We don't need that much pressure. It's around like 1 or 2, the pressure. However, because of surface tension, okay, because we breathe air, we need this much pressure to increase the lung, what's it called, to the lung volume, okay? So this difference between the two curves is actually all by the surface tension. Okay, so and this, how did they figure this out? They placed the lung in water, and they saw how easier it is to expand the lung with water than when it is to compared with air. Why is this happening? Because of surface tension. طيب. Now let's take it a step back. What is surface tension? Okay, these are all water molecules, okay, in a water, basically. طيب. So what's going to happen inside the water, deep inside the water, what's going to happen is that we're going to have these water molecules, okay, and they're going to have force working in every direction, right, left, center, everywhere. طيب. And we're going to have up and down. Now we're going to have also the molecules on the surface, okay, and this is where the name surface tension come from. So focus here. They're going to have opposing forces from right, left, and from down. However, from above, they don't have opposing water molecule. They have air, and that's different opposing force, so it doesn't count. So what's going to happen is that we're going to have net force going downward. There is nothing from upward pulling it upward. There's just something pulling it downward, okay? So it's going to try to collapse upon itself. So the water is going to keep going down and down and down and get close to each other until they reach a point where they make a spherical shape. And that's why raindrops are spherical in shape. It's not because it's going down too fast. No, because of surface tension. Does that make sense?
Can you repeat this part, please?
Sure, yeah, sure. طيب. So, okay. So the water molecules, okay, the polar water molecule, actually, they act with each other. They have forces with each other, okay? So the ones that are deep down, not at the surface, they have forces from all the direction. طيب. This force equals this force equals this force, this force equals this force, and this force equals this force. So the water molecule won't move at all because all the forces are equal. طيب. So this is the first thing. However, the ones at the surface, this force equals this force, this force equals this force, and there we have this force unopposed. So what's going to happen is this force is going to pull it in, and this force is going to pull it in. Force is going to pull it in. Force is going to pull it in. However, we can't just go all the way in because we're going to need, at the end of the day, some molecules in the surface. So it's going to make the most. It's going to try to minimize the surface area, and it's going to make a spherical shape. طيب. Don't go too much into details, but just understand how it happens. And this happens because of polarity. Yes, it happens because of polarity. So this is surface tension. طيب. And they attract each other? Yes, exactly. They attract each other. Does that make sense for whoever asked me to repeat?
Yes, thank you.
تمام. طيب. Okay, now why is surface tension important? Okay, because if we have something called, okay, so we have in the lung, we have something called surfactant, and we have something that is called surface tension. Now, when it comes to surface tension, the important keyword is called recoil force. It's going to cause, again, so we said we're going to cause it to recoil in. طيب. And if any tissue is made of water, it's going to recoil in because of surface tension. طيب. So surface tension equals recoil. Recoil. طيب. Okay. And recoil force is the opposite, recoil, is the opposite of compliance. They're the opposite of each other, okay? But so that means we don't want, if we want the lung to be compliant, we don't want surface tension. Surface tension is the enemy. Oh, sorry. I just messed up something in my laptop. Okay, surface tension is the enemy. On the other hand, and recoil is also the enemy. On the other hand, we want surfactant. طيب? And we're going to get to what is surfactant in a bit, okay? Surfactant is going to oppose surface tension. It's going to be the opposite. And here I put a meme, whoever finds it cringe, thank you. I put effort into this, by the way. But yeah. Anyways, okay. So, okay, let's say we have a lung without surfactant, okay? And we have, for some reason, okay, we have, for example, this alveoli, it's small, okay? And the pressure here is higher. Because it's smaller and we have more condensed air, the pressure will be higher here when compared to the pressure here. Here will be lower. So what's going to happen? Always, what did I tell you? I told you that the air will always move from area of high pressure to area of lower pressure. And this is what's going to happen. It's going to move from area of lower pressure to area of higher pressure. And it's going to move towards this bigger alveoli with lower pressure. And this one is going to collapse. And that's really bad. Imagine in your lung you have collapsed alveoli that don't even work. We don't want that. طيب. Of course, يعني maybe at some point someone will have it. لا سمح الله. بس يعني it could be physiological. It's fine, but we don't want that to happen. Okay. So we have something that is called surfactant. Okay, so what is this surfactant? Surfactant is that basically it's gonna keep the pressure between the bigger and the lower alveoli balanced. Okay, so that's the whole point of surfactant. Okay, I'm gonna come back to this slide. Just give me a minute to explain what is surfactant. Remember, in the surface, basically molecules, they have an unopposed force, so they will try to. They have an unopposed force. Sorry, they will try to go in, right? And a surfactant is that we're going to have a hydrophobic tail that will pull it upward and will oppose this force. So we're going to have zero net force and it's going to stay on the surface. Okay, so surfactant will decrease the surface tension. Decrease surface tension. Tamam? Okay, so the surfactant will decrease the surface tension, and it's really good for us. We want to decrease the surface tension. We want to make the lung more compliant and easier to breathe air. طيب? So these surfactant molecule will replace the surface water molecule. Obviously, not all of them, but just most of them. Okay. طيب. So what are the effects of surfactants? Is that it's going to increase the compliance. Why is that? Because it's decreasing the surface tension. طيب? And it's going to minimize the collapsing tendency of the alveoli. Why? Because we have here, okay, the surfactant is preventing it from collapsing, okay, because it's balancing the pressure. Look, the air will not move from here to here anymore because we're having balanced pressure. طيب? Okay, then it's going to decrease the pressure difference, which is I just mentioned. Okay, now before I move on, it's just worthy to mention that the doctor talked about this equation. I don't know like what to explain it. It's just the equation that shows basically the relationship of the surface tension to the radius with the pressure. So the lower the radius, the higher the pressure, and the higher the surface tension, the higher the pressure. Yani just keep that in the mind. I don't know if you need to memorize the equation or not. Just keep it in the back of your head for any reason. Yani. Just the main concept of this is the action of surfactant. Surfactant and surface tension are against each other. Surfactant will increase compliance, surface tension will decrease compliance. Does that make sense? And I hope you remember this picture in the exam when you're stuck between which is which. Can you explain point A? Yes, okay. So point A is showing us if we don't have surfactant, the pressure is not balanced, okay, between the alveoli, okay? So the pressure in the smaller alveoli will be higher when compared to the pressure in the lower, bigger alveoli, okay? Why? Let's say in the beginning, in the first place, why would we have, for example, more air in this one when compared to this one? Okay, we could have an obstruction here for any reason. Okay, so this one will be smaller, more condensed, more pressure. Okay, but for now, just keep in mind, let's say we have, for any reason, a higher pressure in this alveoli. Air will always move from area of high pressure to area of lower pressure. And by convenience, that means from here to here. Type. When air moves from here to here, what's going to happen is that this is going to shrink in size. We don't have any more volume anymore. Does that make sense? So that's point A. Okay, alhamdulillah. طيب. Everything from here is easy, alhamdulillah. طيب, I already explained this, okay? And here's another picture that shows basically two alveoli that started around the same size. Okay, here it is. And for any reason, one of them expanded more than the other. طيب. Now, it is the surfactant job is that now when this one expands more, what's going to happen is that the concentration of the surfactant is going to decrease. And this one, since it's not increasing in size this much, the surfactant's concentration will be higher. Okay, so this means that the pressure difference here and here will be equal to each other. طيب? Because of the surfactant concentration. Can you please repeat how the surfactant does its job? Okay, طيب. So this is the surfactant. Okay, okay. By the way, just for you guys who are worried about like really understanding every detail, the whole thing you need to understand is the whole concept. And the whole concept is that surfactants is there to increase compliance and is there to oppose the surface tension. Okay? So now from the beginning, we said that those water molecules, since they don't have an opposing force here, what's going to happen is that they're going to go in and they're going to collapse and they're going to form the spherical shape that we talked about, the spherical shape here. However, in surfactants, when we have surfactant molecule, what does it mean? Is that basically we're going to have a molecule just like water, okay? It's going to have opposing forces, okay? And these opposing forces will be all directions. And why is it important to be in all direction? So that this molecule will not actually create any tension, okay? It will stay in its place. And that's what we want. We don't want any surface tension, any force resisting compliance, okay? Does that make sense? If it doesn't, it's okay. Just tell me so I explain again. It's fine. Okay, no problem. So the whole point of surfactant is multiple things. We're going to talk about it in the last slide. But for now, okay, so now let's say we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. We have 14 surfactant molecule in each of these alveoli. This alveoli doesn't expand as much, okay? However, the surfactant concentration will be higher when compared to this alveoli because it expands more. طيب? So this means that even though we have more air here now, the pressure will be equal in these two. So pressure 1 will equals pressure 2, and we're not going to have collapsing of alveoli just like happened here. Tamam? So that's basically the point of surfactants. Okay? Does that make sense? If it doesn't, let me know. It's okay. Yes. Okay, tamam. طيب, here is a summary of what are the effects of the surfactant. We said it reduces the surface tension and increases the compliance. That's the first point. Tamam? We understand this. We said it minimizes the fluid accumulation. Now, why does it minimize the fluid accumulation? Because it has a hydrophobic tail. Okay. Now, I don't know if he's going to ask you about this, but just keep that in mind. Okay, it has a hydrophobic tail, means it will not allow water to go inside the alveoli because it's at the surface. Okay, so we have this alveoli and we have the surfactants here. It will not allow water to accumulate in the alveolar surface. Why? Because this is a hydrophobic tail. طيب? So that's another point. Now, it will keep the uniform, basically the alveolar size relatively uniform, okay? And it will try to basically equalize the ventilation. And this is exactly what is being done here, okay? Even though this one is expanding more, it tries that surfactant concentration will be decreased and the pressure will be maintained and the alveoli will not collapse upon itself. طيب? So these are the three main jobs of the surfactants. Surfactants will reduce the surface tension and increase the compliance. Okay, it will prevent the fluid accumulation. Okay, and lastly, it will take care of the collapsing of the alveoli by maintaining equal pressure in both alveoli. So this is basically the surfactant in a summary. طيب? So even if you don't understand the concept, which I prefer you do, memorize these. Literally, the question will come from here. تمام? Is everything clear so far?
Yes, thank you so much.
تمام. طيب, I'm going to ask you a couple of questions, but then I will revise quickly. I mean, actually, there's 2 more slides. Then I'm going to ask a question. Then I'm going to revise quickly all the concepts to make sure everything is okay. طيب. So, okay, so this is just a slide. Okay, can we say surfactant increases the surface area? I haven't thought of that, honestly. I'm not sure. maybe you can, maybe not. I'm not sure, honestly, but just keep in mind, surfactant decreases surface tension. Maybe it decreases surface area, and I think you're right, because that means we're gonna have lesser surface area because it's not becoming like a spherical in shape anymore. I think you're right, yes, but don't think in this way. Maybe this as an extra fact, up to you. Okay, so where is surfactant produced? It's produced in type 2 alveolar cells, and I guess have you taken histology, guys? Well,
Yes.
Yes, we did.
we have type 1 and type 2 pneumocytes. صح? Type 2 pneumocytes or alveolar cells are the ones that produces surfactant. Just know it as a fact. There is nothing much to understand in it. Okay. And here, this slide is just telling you that in the areas around the corners, the surfactant is going to be higher. Why is it? Because it's like a smaller in diameter and it's more likely to collapse. So we're going to have more concentrated surfactant, preventing it from collapsing. Tamam? So it's like a counteracting force. طيب? Is everything clear so far?
Yes.
Okay, tamam. And here I have a question. Just to make sure I summarize the compliance factors and you guys understand, please let me know in the chat privately which of the following is the correct, corresponding to its own, like to the adjacent. So surface tension doesn't increase or decrease or whatever. Let me know. If you don't understand the question, let me know as well. Okay, I'm getting correct answers so far. Okay, alhamdulillah, most of you guys are answering correct, or actually all of you. No one answered incorrect. If you don't understand, let me know. So basically, we're going to talk about this. Okay, elasticity will increase the surface tension. We already talked about this. Not surface, sorry. Elasticity will increase the compliance. And surfactant will increase the compliance, and surface tension will decrease. Why is that? Because that's what I've been explaining for the past 30 minutes. So I hope you get it. Now, taking this into a more theoretical point of view, or like more theoretical view of the question, this is what the question could look like. So let me know the answer in private, please. Okay. All of you guys, alhamdulillah, so far answered correctly. Someone answered incorrect, but I want that person himself to answer the question correct. Okay. So, okay. So the answer is D. Okay. Someone answered A. Okay. So for that person,
Yeah, it's me. I think I didn't read it really well, but I know that
Do you
the
understand
surface
why?
tension, yeah, surface tension increases, but the pulmonary compliance decreases. I just like, I send it really fastly. That's why.
It's
That's it.
okay. It's okay. It's okay. If you get the concept, that's what matters to me.
I didn't read really well the questions. That's why.
It's okay. It's okay. You need to focus on the keywords. So let's go through this again. So we have surfactant deficiency, and this happens actually in acute respiratory distress syndrome in preterm infants. Okay, just keep that in mind. Okay. Okay. Now surfactant deficiency. Okay, so we have less surfactant. And what did we say? If we have less surfactant, we have what? Increased surface tension. So all of these are wrong. So that leaves us with 3 options. Okay. Now, looking at this, okay, so increased surface tension, is it going to decrease or increase compliance? It's going to decrease compliance. And this is the only right answer. So the answer is D. Inshallah, I've made it simple for you guys. I hope it did make sense for everyone. If it doesn't, let me know so I re-explain anything. Okay. So that brings me to the end of my slides. I hope I explained well. The lecture is easy, alhamdulillah. I tried to make it simpler. Yeah, sure.
I
Go
just
ahead.
have one question. Resective diseases, they like fibrosis, they increase compliance. No, sorry.
Okay, here. So for these diseases, okay, so we have emphysema. Oh, Okay, so emphysema, we're gonna have increased compliance, and fibrosis, we're gonna have decreased compliance. This is the normal curve. In the exam, they will bring you the curve. They won't bring you, wallah, what happens in emphysema. They might bring you in a different lecture, I'm not sure. But from this lecture, this graph, I'm sure it will come. I am sure. Yani, inshallah, it will come, and you will remember the answer. And it's a simple question. They will bring you these graphs. They will bring you these graphs without the labels.
Mhm.
And they will ask you in one of two ways. They will tell you which of the following is the normal, or which of the following is emphysema, or they will point at this. For example, they will point at this one and will ask you which of the following is this. Okay, your answer should be fibrosis
Mhm.
because you have decreased compliance.
Yeah, I keep confusing fibrosis for emphysema because it says obstructive, and I keep mixing up obstructive and resective diseases.
Okay. I guess some of the, and we have upcoming sessions on that. If not, you can contact me later and I can explain it, no problem.
Okay.
For now, I'm gonna stop the recording or pause it, up to you, host.